Hello, and thank you for watching my final presentation for my health policy class at Florida Atlantic University, where I am proposing a health policy helping marginalized community with access to telehealth services for type 2 diabetes. I would like to tell you the story of Lisa, who has tirelessly been raising her two children by herself, devoted to provide for them and keep their heads just above water with a father who offers no support. Lisa has found herself navigating a relentless sea of financial hardship just to make ends meet. She has indeed resorted to cutting corners and relying on low-cost processed foods and the convenience of cheap and fast meals. Her own well-being has taken a back seat as she has grappled with the ever-present yo-yo weight gain and weight loss, battling an internal war of self-love. Despite her own physical struggles, Lisa's unwavering devotion has been to her children, which has remained her top priority. Burdened by the weight of her responsibilities, Lisa has become acutely aware of her underlying health conditions: hypertension, high blood pressure, and type 2 diabetes. She knew that with regular medical checkups and careful management, she could tackle this. Not just for her sake, but also for the sake of her children. For months, Lisa has made this solemn promise to herself that she would indeed prioritize her health. She eventually discovered an endocrinologist who was known for their empathetic approach in helping their patients maintain their diabetes. With this doctor, she found a rare sanctuary where she wasn't treated as just another patient or a number, but an amazing doctor who didn't pass judgment or shame for her weight or her illness. This doctor understood the daily struggle of survival. The challenge of raising these children alone was, let alone, a challenge in and of itself. There was empathy and collaboration with this doctor rather than blame. Such a compassionate physician has truly earned a well-deserved reputation. Therefore, her demand has been so high that her patients has faced a 4-month waiting list. The only downside was that this caring doctor's office was located at a massive hospital complex 3 bus rides away. But Lisa was willing to go that extra mile, quite literally, because her children needed her to do this, and they were worth it. And this doctor's care was truly exceptional. The silver lining was that Lisa lived only 2 blocks away from a Quest Diagnostic Center where she could easily walk to have her blood drawn, thus minimizing her trips to the doctor's office. One particular day, Lisa had a vital follow-up appointment scheduled. Her doctor needed to discuss adjusting her medication as it wasn't working as effectively as they had initially hoped. Lisa fully comprehended the critical nature of these appointments with her healthcare provider and her well-being. But as many single mothers can attest, life was anything but predictable. On that morning of her appointment, her youngest child was struck with a fever, and her oldest child complained of feeling unwell as well. Sending them to school was truly out of the question, as it would only result in them being sent back. Faced with this agonizing dilemma, Lisa had to take the choice into her hands, the heartbreaking choice. She recognized that at that very moment, her children needed her more than anything, and dragging them across town on 3 buses there and 3 buses back was just not an option. They needed her comforting presence. They needed rest and the care that only a mother could give. With a heavy heart, Lisa made the painful decision to skip her doctor's appointment. She prioritized her children's well-being over her own. Fully aware of the risks posed by missing her follow-up appointment, when she called the doctor's office to explain, the receptionist added the pressure, reminding her of how overbooked this doctor's office truly was. Lisa, overwhelmed and embarrassed, couldn't even bring herself to reschedule and just hung up the phone. Lisa's story is a stark reminder of the countless single mothers who confront these heart-wrenching choices every day. It underscores the monumental sacrifices patients make and parents make for the sake of their children's health and happiness. It also underscores the pressing need for improved access to healthcare and support systems that can alleviate the burden of individuals like Lisa. Imagine if Lisa didn't have to miss her doctor's appointment at all. What if she could have connected with her physician through a Zoom call while her children slept peacefully beside her in the comfort of their very own home? As we delve into today's presentation, let's keep Lisa's story in our hearts and remember that often the most profound acts of heroism occur within the context of our daily lives, within our own communities, and within the hearts of single mothers like Lisa. The reality is, a wealthier community is simply going to have access to more money and resources than a poorer community. This also applies to rural communities, which may not have the same level of technology that a state-of-the-art urban facility may have. This often leads to less wealthy people receiving lower quality health care. When you add the fact that people in poor communities probably need more health care than those in the wealthier communities, the problem becomes even more obvious. This also leads to certain ethnicities being struck with lower quality of care, leading to disparities in healthcare that the Institute of Medicine often talks about. I would love this policy to help fight this trend so that we can get to the best quality of care to the greatest number of people possible. My name is Misty Alicea, and I am an executive master's in healthcare administration student. I graduated last semester with my executive master's in business, and I have one more semester until I finish my dual degree. I am a social worker, and this is something passionate to my heart. I am a type 2 diabetes patient, and I do think that instead of fighting the obstacles and hurdles to get to a doctor's office for your follow-up, you could very easily do it via telehealth, which is why I thought of this healthcare policy. My problem statement. Providing access to high quality healthcare is a major issue for individuals living in low income communities who are affected by type 2 diabetes. This results in delaying diagnosis and inadequate treatment, causing patients to discontinue their care, miss their appointments, and ultimately suffer from deteriorating health outcomes. This significant inequality highlights a pressing national health concern that requires a comprehensive solution. Now, let's analyze some of the critical aspects of healthcare that often take place outside of the confines of a hospital or clinic, which is called the social determinants of health. Did you know that a staggering 80% of what shapes an individual's health occurs outside of a medical setting? Astonishingly, half of this influence can be attributed to something as seemingly simple as your zip code. In 2022, the Centers of Disease Control and Prevention highlighted a crucial point. The social determinants of health have a more substantial impact on health than your genetic factors or even your access to healthcare services at all. Did you know that poverty is strongly linked to adverse health outcomes and a heightened risk of premature death? Identifying the most marginalized communities affected by social determinants of health is complex and context specific, as different factors contribute to marginalization in various regions and populations. However, some groups commonly are recognized as being disproportionately affected by the social determinants of health, which include racial and ethnic minorities, including communities of color, African Americans, Hispanic, Indigenous people of color, and other minority groups. They often face systemic discrimination, economic disparities, and limited access to quality education and healthcare. Low-income communities. These individuals and families have low social economical status. They experience challenges related to housing instability, food insecurity, limited educational opportunities, and inadequate access to healthcare. The LGBTQIA+++, and specifically the trans communities, often face discrimination, social exclusion, and healthcare disparities. These communities can experience higher rates of mental health issues, substance abuse, and limited access to culturally competent providers. Immigrants and refugee populations. These patients may encounter barriers such as language difficulties, discrimination, limited employment opportunities, and challenges in accessing social services and healthcare. People with disabilities, both visible and invisible. These patients often experience barriers to education, employment, and healthcare, impacting their overall health and well-being. Accessibility issues and social stigma can further contribute to their marginalization. Women and gender minorities often face gender-based discrimination, limited access to reproductive health care, and disparities in educational and economic opportunities. Homeless populations often experience homelessness while encountering a multitude of social determinants of health factors, including lack of stable housing, limited access to healthcare, and challenges in meeting basic needs such as food and hygiene. Youth in foster care experience disruptions in their education, limited social support, and higher rates of mental health issues, contributing to long-term health disparities. Indigenous and tribal communities face marginalization impacting their access to resources, healthcare, and cultural preservation. It's important to note that these categories are not mutually exclusive, and individuals may belong to multiple marginalized groups simultaneously. Additionally, the impact of social determinants of health can vary from each group based on factors such as geographic location, socioeconomic status, historical context. Addressing health disparities requires a nuanced understanding of specific challenges faced by different communities and the development of targeted interventions to promote equality. The social determinants of health significantly impact marginalized communities, often exacerbating existing health disparities and creating barriers to well-being. Several factors contribute to the heightened impact of the social determinants of health on marginalized populations, including but not limited to access to healthcare. Limited financial resources can also restrict access to nutritious food, safe housing, education, all of which are crucial to one's good health. Educational disparities are strongly linked to health. Marginalized communities often experience disparities in educational attainment, limiting their access to information, job opportunities, and overall health literacy. Unsafe housing and environmental risks. Living in substandard housing, facing environmental hazards can contribute to a range of health issues. Discrimination and social exclusion based on your race, ethnicity, gender, sexual orientation, gender identity, or other factors that can have a profound effect on your mental and physical health. Chronic stress from systemic discrimination contributes to health disparities. Limited employment opportunities lead to job insecurity and economic instability. Stable employment is closely linked to access to healthcare and the limited ability to afford essential needs. Cultural and linguistic barriers create barriers to healthcare and social services. Limited social support. Strong social support is crucial for mental and emotional well-being. Marginalized individuals may experience isolation and lack of community resources, impacting their ability to cope with stressors and maintain good mental health. Addressing these health disparities in marginalized communities requires a comprehensive approach that considers a multifaceted nature of social determinants. Advocacy for policy changes, community engagement, and efforts to promote equality in healthcare and social services are essential components of addressing the impact of the social determinants of health on marginalized populations. Now, considering the marginalization of racial and ethnic minorities, and specifically Black single mothers like Lisa, I found Sabrina String's book, Fearing the Black Body, which explores the intersection of race and body size and cultural expectations, with a particular focus on Black women. Strings examines the way in which cultural norms, beauty standards, and medical discourse have influenced perceptions of Black women's bodies. By tracing the historical roots of these ideals, she sheds light on the social and political implications of body size for Black women, highlighting the complexities and challenges that they face in navigating societal expectations. Overall, the book offers a critical analysis of the connections between race, body image, and power dynamics, contributing to a broader understanding of cultural forces shaping our perceptions of bodies. Now, bringing it home to South Florida, and specifically Broward County, shockingly, less than 20% of Black women residing in Broward County have quote unquote normal body weight. Now, let me say that in a different way. Over 80% of Black women are obese, and nearly 15% are classified as extremely obese. This cultural expectation not only affects physical health, but also creates a social stigma, making it difficult for Black mothers to openly discuss their conditions and seek much needed support. Now, going back to the social determinants of health, and specifically Black bodies, several alarming disparities exist, including maternal mortality. Black women are more likely to die from pregnancy-related complications. Breast cancer. Black women are more likely to be diagnosed with aggressive forms of breast cancer and tend to have lower survival rates. Hypertension. High blood pressure is more prevalent among Black women, and they often experience it at a much younger age, increasing the risk of cardiovascular disease. Obesity, just discussed, is associated with various health issues, including diabetes, heart disease, and certain types of cancer. HIV and AIDS. Black women are disproportionately affected by HIV. Mental health. Black women are more likely to experience mental health issues like depression and anxiety, but often face barriers to accessing mental health services and support. Access to healthcare, specifically affordability and quality of care, can result in delayed and inadequate medical care for Black women, impacting their overall health outcome. Cervical cancer. Black women have higher rates of cervical cancer due to disparities in access to preventative healthcare services like pap smears. Infant mortality. Black infants have a higher risk of infant mortality, which is linked to maternal health disparities and limited access to quality prenatal and postnatal care. Life expectancy. Black women on average have a much shorter life expectancy compared to women of other racial and ethnic backgrounds. How can we address these challenges and ensure that these women are able to receive the necessary support and care? Can telehealth alleviate these concerns? Now let's talk about type 2 diabetes globally. It's a global epidemic. The American Diabetes Association, or the ADA, has documented the economic impact of diabetes in the United States alone over the years, revealing a harsh reality. In 2007, the total direct cost of diabetes was $116 billion, escalating to $176 billion in 2012, and a staggering $308 billion in 2022. This means that diabetes care now represents approximately 1 in 4 healthcare dollars spent in the United States alone, with an average cost of $16,752 per year per person. The implications are clear. The economic burden of diabetes is substantial and rising. In the United States alone, type 2 diabetes has become a silent epidemic, affecting approximately 37 million people. This progressive condition not only poses immediate health risk, but also significantly increases the likelihood of heart attacks, strokes, kidney disease, blindness, amputation, and even erectile dysfunction. This should be a wake-up call to the urgent need for awareness, combined efforts, and innovative solutions to addressing this escalating epidemic. Like, oh, I don't know, an innovative solution like So now that we know this is a global epidemic, what exactly is type 2 diabetes? Also known as non-insulin dependent diabetes mellitus or adult onset diabetes. It is a chronic medical condition that affects the way your body metabolizes glucose or sugar for energy. It is the most common form of diabetes, accounting for the most cases worldwide. Type 2 diabetes is often associated with lifestyle and genetic factors, but in reality, there are multiple risk factors associated with the development of type 2 diabetes, included to obesity, sedentary lifestyle, a family history, high blood pressure, and of course, ethnicity. Like I mentioned earlier, type 2 diabetes can cause serious complications. A recent research study has shown that breast cancer mortality has significantly increased in women who have been diagnosed with diabetes at least 5 years before their cancer occurred. Chronic conditions, chronic meaning gradually happening over time but leading to serious damage if going unchecked, can include eye problems or retinopathy. Some people with diabetes develop an eye disease called diabetic retinopathy, which can affect their eyesight. Foot problems. Diabetic foot problems are very serious and can lead to amputation if going untreated. Nerve damage can affect the feeling in your feet so you don't even know that you've been cut or hurt. Raised blood sugar can decrease the amount of circulation in your feet, making it slower for sores and cuts to heal. Heart attacks and stroke. When you have diabetes, high blood pressure for a period of time, this can change your blood vessels, making you more prone to serious heart attacks and strokes. Kidney problems, nerve damage. Your nerves carry messages from your brain to every single part of your body. This can affect how you see, how you hear, how you feel, and how you move. Gum disease. When you have too much sugar in your mouth, in your blood, you also have too much sugar in your saliva, which can lead to gum disease and erosion of your tooth enamel. Again, cancer. Most people with diabetes are much more prone to certain types of cancers. Sexual problems in women. When you have diabetes, it can restrict the amount of blood flowing to your sexual organs, which can lead to loss of sensation. If you do have high blood sugar, you're more prone to getting thrush or UTIs. Sexual problems in men. The amount of blood flowing to your sexual organs can be restricted, which may cause you to have difficulty getting aroused or keeping an erection, sometimes causing you to be impotent. Acute complications. These are complications that can happen all at once and may lead to chronic or long-term complications, such as HHS. This is a life-threatening emergency that only happens in people with type 2 diabetes, and it is brought on by severe dehydration and very high blood sugar. Diabetic ketosis, a life-threatening emergency that the lack of insulin and high blood sugars lead to a buildup of ketones. Needless to say, it is very important to stay on top of your health. If you suffer from type 2 diabetes, this will often involve a combination of lifestyle changes and, in some cases, medications. Lifestyle modifications may include balanced diet, regular physical activity, weight management, and getting regular checkups to help you stay on top of your disease and delay the onset of any of these conditions. This initiative is aimed at implementing a policy that will revolutionize telehealth services, ensuring equitable access and encouraging consistent engagement in healthcare for marginalized community members dealing with type 2 diabetes in Broward County. We now know several of the social determinants of health factors that play into the need for telehealth services, including limited access to quality healthcare. So the primary goal is clear: to enhance healthcare adherence among marginalized communities managing type 2 diabetes in Broward County. The primary goal will be to improve healthcare adherence. Let's ensure that those afraid to or unable to leave their house can consistently engage in healthcare services, thereby significantly reducing their risks associated with unmanaged diabetes. Next, let's make telehealth more accessible and user-friendly for this target population. Let's encourage healthcare providers to offer telehealth appointments for diabetes. You can go to Quest Diagnostic or LabCorp and draw your blood. And then if it's difficult to get to the office, you can visit with your doctor virtually to discuss your personal goals and challenges with your adherence. Identifying and eliminating barriers to care is central to this program. Telehealth can help with several issues, from transportation to finding childcare. If the clients do not have a computer, you could utilize cell phones for telehealth visits. And in Broward County, anyone with government assistance can get access to free cell phones. By addressing these disparities, the goal is to reduce the gap in healthcare outcomes between the underserved populations and others by leveraging telehealth as an equalizer. Everyone, regardless of their socioeconomic background, should have equal access to quality healthcare. Empowering patients is a priority. Through telehealth support and education, we could ensure that marginalized patients feel confident and equipped to actively participate in their own healthcare journey, thus motivating them to focus on their preventative care as well. By increasing doctors offering telehealth visits for follow-up care, it would encourage more frequent check-ins and preventative measures for type 2 diabetes. As we navigate the landscape of improving and offering telehealth to type 2 diabetes patients in underserved communities, let's delve into our policy options. Firstly, under the telehealth expansion umbrella, we should have initiatives to ensure widespread access to telemedicine services. This would include fostering video consultations and remote monitoring, ushering in a new era of accessible healthcare. Additionally, we'd push the boundaries for advocating for the integration of a secure messaging system where healthcare providers can offer enhanced patient care. Moving on to educational resources, we can recognize the importance of empowering individuals. We propose the development of comprehensive online platforms designed specifically for diabetes management. This encompasses crucial elements such as dietary guidance, exercise routines, glucose tracking, and medication adherence support. And now, as we lay the foundation for a robust healthcare infrastructure, our focus shifts to telehealth. This would involve strategic investment in broadband expansion to underserved areas, ensuring that even the most remote parts of Broward County would have the connection availability needed for effective telehealth services, thus ensuring reliable internet connectivity, a vital component for the success of this initiative. As we move forward, please keep these pillars in mind: telehealth expansion, educational resources, and telehealth infrastructure. They're the building blocks of our strategy to revolutionize type 2 diabetes care. As I bring this presentation to a close, let's reflect on the profound impact that this policy could have on addressing the national epidemic of type 2 diabetes. This policy could help contribute to a healthier and more equitable future for all. It would not just be proposing change, but also the groundwork for a transformative shift in healthcare. Our expected outcomes could be improved diabetes management and reduced complications, enhance healthcare equity and reduce disparities in diabetes care, potential cost savings through proactive diabetes management, and increased access to healthcare and education for rural and low-income communities, as well as those othered by society. These are not just outcomes, but they are milestones in a journey towards a more inclusive and effective healthcare system. I personally am excited to share the promising future where individuals like Lisa, the Black single mother in the beginning of my presentation with type 2 diabetes, where individuals like Lisa may have this proposed policy to increase their access to telehealth services. I believe Lisa's path as well as other marginalized community members could be positively impacted through telehealth as a regular medical care They could have a number of advantages, including their ability to make a proactive approach to managing their diabetes. Thanks to the ease of virtual communications and consultants and the adaptability of remote monitoring. With the potential for regular check-ins and support, she could experience a more personalized and accessible healthcare journey. The culturally sensitive nature of telehealth services can further enhance her experience, fostering trust and engagement. Fundamentally, this policy is about individuals like Lisa, the potential positive impact on their lives. Thank you for your consideration. Together, we can embark on a journey towards a future where healthcare is not just a service, but a catalyst for positive change in the lives for those who need it the most. Congratulations, you've made it this far. You're at the end. And to all of the esteemed viewers, Professor, and my classmates, my silent but ever engaged audience behind your screens, thank you for joining me on this virtual journey. Now, before you reach for that imaginary raising hand button, I regret to inform you that in the magical realm of pre-recorded presentations, your questions will have to wait for another dimension where time and space are not combined by simple ones and zeros. In the meantime, remember, the real magic happens not in the answers we receive, but in the questions we dare to ask. So keep those inquiries coming, and let's keep the conversation alive, even if it's in the language of pixels, and algorithms. As I told you in the beginning of class, I don't like online classes. But until we meet again in the land of zeros and ones, stay curious, stay clever, and stay virtually connected. Thank you, and may your Wi-Fi signal be forever strong. And remember, healthcare policy is amazing.